we heard congressional reaction to today's critical Supreme Court arguments on chemical abortion. But now we turn our attention to the Catholic medical community and its stance on the ethics and safety of using mifepristone. Joining us now is Dr. Grazie Pozo Christie, a radiologist who filed an amicus brief on this case on behalf of the Catholic Association Foundation. Dr. Christie, always so good to be with you. So tell us what stuck out to you when you were hearing these oral arguments today.
Well, I was sorry to hear that so much of the case was about standing and that, frankly, the justices didn't seem very convinced by the standing arguments of the plaintiffs. Doctors like me, Catholic doctors, who are very concerned with the safety, with maternal safety. There's nothing we can do at this point about the ubiquity and the widespread use of the chemical abortion drug and the way that it eliminates children. But we can at least work for maternal safety. And it's very difficult to watch all the regulations being stripped away, all the maternal safety safeguards, I should say, being stripped away from the chemical abortion drug. Safeguards that are very important because this is a dangerous drug. You hear people say that it's like Tylenol, and that's simply not true.
Yeah, and I know in your amicus brief you mentioned the severe health risks caused by the deregulation of these abortion pills. Talk to us a little bit more about that.
So from my point of view, I'm a radiologist, and I do every day I do ultrasounds of women and their babies, women who are just in the early parts of their pregnancy when these chemical abortion drugs you're able to use them with relative safety. However, what I find is that an ultrasound is very important because women don't know how far along they are. They are very often mistaken about that. They don't know the age of their baby. And these chemical abortion drugs get more and more dangerous with every week that passes. So the FDA allows this drug to be used up to 70 days of pregnancy. But in my experience, and this is an experience of many years and lots of patients, women are very often much more pregnant than they think they are. Their babies are older than they think their babies are. So when you take away the physician requirement and the in-person visits, and you allow women and girls to access this drug by speaking to someone on the phone or doing a video consult with someone across the country and then receiving the drugs by mail, you are taking away all these important safeguards for maternal safety, for their lives, for their health, and on so many levels. It's a really terrible thing that the FDA has done, and I think they've done it for political reasons.
Yeah, I know you also focus on the type of emergency room visits that could happen and how they would affect Catholic doctors and hospitals. Can you explain that to us?
Well, because they've taken away the in-person requirement, right? So it used to be that to access this drug, you had to go see, first of all, a physician, not anyone else, but a physician. And the physician had to examine you in person, usually do an ultrasound to see really how pregnant the mother is, and then dispense the drug in person and then have a follow-up visit. So all these contacts with the physician were ways to avoid complications. And if there were complications, to treat for that physician who knows the patient, who knows the process, to treat the complication appropriately. What ends up happening when you have dispensing of the drug over mail, for instance, is women have these unavoidable complications, which are not rare, and they end up in emergency rooms being treated by doctors who don't know the story and who have to step in and sometimes basically participate in an abortion when they are not prepared to do that because they're either Catholics like me or Christians or other people of religious faith, or simply they're just ethical doctors who don't end lives.
Well, so much more we can talk about, but we have to leave it right there. Thank you so much for coming on and speaking to us about all of this. We always appreciate it. God bless you.
It's a pleasure for me. Thank you.